Hey guys, welcome back to another episode of the Mind Muscle Connection podcast. Today I have a very special guest on, Dr. Nicholas Fabiano. He is a third-year psychiatry resident at the University of Ottawa in Canada. His research interests encompass diagnostic imaging, meta research, mental health, particularly the role of exercise and physical activity, systematic reviews, and the intersection of psychiatry with broader health and social issues. Nicholas, really appreciate your time, man, and thanks for coming on today. Really looking forward to chatting with you, mainly around creatine, but I'm sure, as we said, we'll dive into some other stuff as well, too.
Yeah, thank you for having me.
Yeah, I've been following you on, I still call it Twitter. I just
I
have
think
a hard
most
time.
people do.
I have a hard time calling it X. I don't know why, for a while now. And you always are posting great information, especially around like research. I feel like you have at least, what do you shoot for, like something daily essentially there with that?
Yeah, no, it's been good. It's been a nice outlet to just talk about different topics, and it's better than just the traditional publishing route where you put a paper out, you don't really get any feedback. Whereas on Twitter or X, you can put something out there, summarize it in more of a digestible way. That way, you get input from people that just isn't this inner circle of scientists in a specific area. So I found it helpful to get feedback, but also generate new ideas because the more people you have looking at something, the more ideas, the more critically something's assessed. So I think it's important to get more people to read stuff just to grow the space.
Yeah, and I'm sure you get some interesting feedback on Twitter as well too, right? You have to
Mm.
take some of it with a grain of salt, but
Oh, for sure.
actually looking through your X, I was able to see some questions people had around creatine, which I thought was super
Mhm.
important, right? Because as we get engulfed with all this, you're doing research, we look at it I feel like from a little bit of a different lens, and you don't really realize maybe some of the
Mhm.
misconceptions or like just general questions people have around it. I like to start with a new guest is just give the audience maybe just a little background and just how you got to where you're at today. You can go as in depth as you want, or just maybe the general outline,
Mhm.
whatever works best for you there.
Yeah, so I guess to start off at the very beginning, in terms of even the introduction for me, you mentioned one of my research interests was diagnostic imaging, and that started at the beginning of medical school where I was actually interested in radiology first, which for those in medicine, it's the complete opposite spectrum to psychiatry. Radiology is very, you're facing screens, you're reading scans, you don't really see people, you're in the dark, to psychiatry. And that switch came from, I've always had a longstanding interest in fitness. I played soccer my life. I've been into weightlifting more often. So I wanted to bridge that and thought I wanted to do more of a sports medicine sort of career, but it didn't really get all the different aspects that I wanted into one. And it wasn't until I did my psychiatry rotation at the end that I switched to psychiatry. From there, I've had this sub interest of the broadly is the overlap between physical and mental health, but more narrow is the lifestyle interventions for mental health. So that's things like exercise, diet, sleep to treat mental disorders, but also to help prevent them because I think it's something that we oftentimes overlook. And it also feeds back to the point that I made before of the overlap between physical and mental health. It really connects the two. One personal story that I had actually happened in medical school where I noticed personally the impacts of the two on one another is it's funny. I was arm wrestling a friend and I actually broke my arm. And you can, I don't know if there'll be video on this, but I have a nice
Oh,
scar that
wow.
goes right there. So I was out for a few months from doing the things that I really like to do. And I was told first I sustained nerve damage too. So my radial nerve, which is controls a lot of the functions of your wrist, you some of the sensation of your forearm, etc. It pretty much wasn't working after the surgery. I couldn't even pick up like a water bottle. Like my wrist would just go limp, and then I noticed how profoundly that impacted me. So just from day to day, right arm is my dominant arm. I couldn't even write my exams. I had to use my left arm. Eating food. When I started getting back into working out as well too, it was hard because I would have the strength to do a bicep curl, but my wrist would give out. You can imagine doing a curl like that is not very efficient nor pain free. So I found the impact that had on my mental health because that was a time where I was just starting to get into the weights and stuff, the whole newbie game things. I was making a lot of progress in 1 year. I was super, super skinny before. I was probably like 110 pounds and I gained in that 1 year like 40 pounds. Obviously, not pure muscle, but it was a big change.
Yeah.
And then for that to happen so abruptly, and I think that's probably why I broke my arm. I had put a lot of mass on that didn't match my bone density. But it's just a long-winded way to say that I personally there noticed as well too how much the overlap really impacted. And I thought that as stuff got better, that was something that I wanted to share with the patients as well too, and really look into the research for that. So that's what kind of sparked that interest. So my main interest is mostly exercise, but as I mentioned, it extends into diet, sleep, and then as you mentioned, the creatine is an extension to the exercise, even though it's its own entity. Traditionally, it's seen more to be paired with exercise, which is where that idea also came from. So, yeah, there's a mix of my own interests, my own experience, and what I want to share with my patients. And that's what kind of led me to both clinically and research wise where I am today.
Yeah, no, that's awesome because I feel like a lot of, correct me if I'm wrong here, but It just seems like maybe when somebody gets into psychiatry or like mental health side of
Mm.
things, it's probably the physical activity and like those side of things are probably often like overlooked. And
Mm.
maybe it's just from the fact that I don't know if not everyone practices that on their own or what that looks like. Would you say that's like correct? And yeah.
Yeah, I would say in a simplistic sense, most of our treatments are medication, therapy, or both. And even though everyone, common sense wise, knows that exercise and these things are beneficial, I can't speak for everyone, but in a large sense, in my own experience that I've had, is that isn't something that's been heavily emphasized as important, nor a primary treatment. And the irony is, even in our Canadian guidelines, exercise is one of the first line recommendations for depression. So mild or moderate, obviously not severe. But even with that, lots of people aren't aware of that, and lots of people don't necessarily follow that directly. It's more of quick to medications, and it's beyond psychiatry because most people with depression or anxiety, they're seeing their primary care doctor and not even a psychiatrist. And by extension, that as well too is not something that is routinely seen. So I think there's a disconnect between what potential there is for exercise to treat some of these conditions or prevent them and what actually happens in practice. Because a perfect example, as I mentioned, is even though it's in the guidelines that we study, etc., it's still not something that you see put into practice, which clearly shows a disconnect between academia and what's happening in the real clinical setting. And there's a lot of reasons for that, but hopefully that's something that can change in the coming years.
Yeah, obviously people like you are making sure that that gets out there. So that's
Mm.
awesome. Do you think from the exercise standpoint, it's like, hey, it's in the guidelines, right? That everyone
Mm.
knows the importance of it. Is it just
Mm.
something that's, again, most people like, and you mentioned, hey, the potential mental health benefits of exercising, and you noticed the
Mm.
difference of exercising and when you weren't and what that kind of did for your
Mm.
mental health. Is
Mm.
it just what's the barrier there from people doing that? Or what can you speculate on? What's that barrier? If we know it's helpful, you can feel a
Mm.
difference, but then what makes it like something that is not people don't do and can't stick with there?
Yeah, I think there's a few. I think starting at the root cause of education wise, as I mentioned, lots of people aren't even aware that's a first line treatment. And then the second part of that is even if they are aware, they're not comfortable speaking about exercise to their patient. There's been research to show, and this is in the primary care setting, people or physicians that are physically active are more likely to prescribe or speak to their patients about such activities as well too. And we know that not all physicians are physically active. And again, I don't know that it's a fair expectation to say everyone has to do XYZ
Right.
activity, but I do think that there is an onus of responsibility to have a level of education to speak to your patient about some of these things and at least start that discussion. So I think there's a disconnect from there. And I also think there is a time crunch a lot too, especially in the primary care setting. It's hard to really have a discussion with the patient about how to exercise, how to implement that, how to improve your diet, and things like this. Whereas we have these quote unquote quicker fixes where you can prescribe someone a medication, follow up, see how they're doing, sort of thing. So I think there's that. The other thing is too, research wise, there's infinitely more research and studies and randomized control trials to back medications. And that comes from incentive as well, too. So there's not a lot of people that are funding this exercise research, whereas there's more financial incentive to fund a new medication or to fund a new trial for this condition, XYZ. So the literature for exercise is for sure building, and it's grown a lot over the last few years, but it's still a ways behind any of the pharmacological literature. And frankly, it will never catch up because of some of those incentives. And maybe I shouldn't say never, maybe there is a day, but in current times, how things are structured incentive wise, there's competing interest from that front. So I think there's those reasons. And then there's also just the perception of exercise of sometimes when you tell people that this can be used as a treatment for depression, you have some people that are very much on that side and want to support it, but then you also have other people that are saying, hey, like lack of motivation, low mood, these are inherent features of depression. How am I supposed to start exercising? So there's a lot of public factors, provider factors, patient factors that go into why, even though it seems straightforward, that it's just not used routinely. And there's much more even beyond that. But I think in a short discussion, those are probably some of the larger points why we don't see it regularly implemented. But I do think that there is a little bit of a culture shift recently because of the research and it being spoken about more readily. And hopefully that continues in the future. But I think, again, a lot of those things that I mentioned will remain and hopefully change over time. But those are some of the main barriers.
Yeah, that was something that came to my mind of obviously if you are experiencing those mental health issues, it's like you have that low motivation, right? And it's just
Mm-hmm.
it's that catch 22, right? Where it's like you just don't have the motivation to do it. You don't do it, it makes it
Mm-hmm.
worse. And so you have to force yourself to do it. But again, I guess being
Mm-hmm.
in that state is just a lot harder to do that. I also wonder if maybe it also comes down to like people's expectation of exercise, where I feel like the kind of what it's perceived as is like, hey, you need to burn the most calories, you need to just work yourself to the
Mhm.
ground in order to exercise. And so I'm wondering if that's part of it too, where like people have those expectations of it just being this thing that doesn't feel good, which it is
Mhm.
hard, right? We know exercise can be tough, but I always try to shift people from thinking about exercising to like burn calories to like how it makes you feel. And I think that
Mhm.
that shift I think is sometimes missing with when people talk about exercise or their perception of exercise.
Yeah, no, I think that's why when prescribing or speaking about exercise, you have to be very careful about setting these kind of optimal levels. And I actually don't, there are literature-based optimal levels for XYZ parameters of exercise, what to do, sort of thing. But there are many nuances to that because that's based on randomized control trial. That's not a real person. And I think when you set these goals that are ideal, they're oftentimes very difficult to reach for the individual person. And with that, it can be very demotivating if you're having a discussion with a patient and you say, I need you to run an hour a day and everything. And they're saying, like, number one, physically, I can't do that right now. Number two, time wise, like my job, I'm working so many hours, I have to take care of my kids after. And it can be very demotivating for someone to hear that. So it's better to structure in a way that for someone that is sedentary or not moving at all and just going to moving a little bit or a little bit of exercise, whether that's instead of driving home from work, if you live close, walking home and maybe it's a 10, 15-minute walk or something, or while you're at work, taking the stairs rather than the elevator if it's a few floors. Little things like that, you'll actually notice, and this is backed by the literature too, those initial stages of when you're increasing your activity levels, that's where you see the greatest benefit in your antidepressant effects. And there's a little bit of a diminishing return as you get more and more. And it even can go the other way too, where too much exercise is also not a good thing. So I think it's important to, if you're going to talk to your patient about it, number one, ask them if they want to even talk about it, because it can be off-putting for your doctor to just throw exercise and lifestyle in your face. And it can feel bad too, because as a patient, you can feel that you're being blamed for your depression, for your lack thereof of
Yeah.
exercise, which isn't the case. It's a disease as if any other disorder. So I think that's the important thing. You place the emphasis on getting started, starting low, and building up from there, and not necessarily needing to progress. Because the thing is, to even though exercise is helpful to treat depression, sometimes even when optimized, it's not enough. But you can still combine it with other stuff too. So you can combine it with other lifestyle stuff. You can optimize someone's diet, sleep. You can still add medications. You can still add therapy, and together that will better treat depression. Because I think one thing with depression is it's one term, but I've written about this before too. There's over 60 million ways that it can be diagnosed when you combine the different symptoms. So someone's depression can be largely from losing a loved one. Some may term that as grief, but sometimes that can also progress into a depressive phase. Or if you had a breakup, or if you lost your job, or if you have it driven by insomnia specifically. These are all depression if you have it at face value, but they're all very different. So there's different ways to tackle it. But right now, our system looks at it as diagnosis, treatment. Whereas I think it's better to look at it like a complex web of symptoms and you see which one is the most predominant. So you can imagine that someone that has a depression driven by maybe trauma, maybe exercise isn't going to help them a whole lot. Maybe they need to talk about it through therapy, and maybe medications could be helpful too. And exercise isn't going to hurt per se, but perhaps it's not enough to get them through some of those mental struggles that they had experienced in the recent or past future or in the past. So again, our approach, we define depression as one thing, but it can be 60 million things, and we try to treat it with one treatment. So it's no surprise that we don't have great response rates. We have a lot of quote unquote treatment resistant depression because they're also unique. And tackling it with just one thing like exercise or anything isn't going to be effective. And I think going into it like that, you're setting yourself up for defeat for yourself and also the patient.
Yeah, so that's a good point you make. So it sounds like with exercise, it's like somebody could hear this and be like, "Oh, I just need to exercise or whatever, and this is going to cure everything." When really, at the end of the day, it's to me the sound of it is that's a low hanging fruit thing that if somebody's not doing that, okay, this may not cure it or make you 100% better. Right? It's a kind of low risk, high reward type thing that's going to help you move forward at least. And that's again from your just overall health. It's also going to have that benefit as well too. But thinking of it as it's going to be this cure all is also not the case as well too.
No, that's a great point because I think it's important to set your expectations. Otherwise, it's just not going to lead to good outcomes for yourself as the patient, but also as the physician. If you're telling all these people different things, I think it's important to be clear about outcomes. And as you mentioned, having an intervention that benefits someone's physical health as well too is undoubtedly going to benefit someone's mental health, even if it's not to the point of remission for depression. So I think it's a useful intervention if someone's able to engage in that.
Reminds me a lot of is a somebody that works with clients in terms of body recomp, stuff like that, health, improving their body composition. It reminds me a lot of like when people are struggling or they're not seeing the results they want to see, or just again in terms of people will be like, hey, you need to do this approach, you need to do this, when really you need to dive into the specific person and see their unique like history, what they've been doing, what potential issues they have going on versus just being like, this is what you need to do. It sounds somewhat similar to that.
Yeah, no, I think it's looking at each person as an individual person, because the same as you mentioned, a lot of our research in medicine is based on randomized control trials, meta-analyses when we bring these studies together. And it is very helpful to inform overall trends. But to remind yourself that in these randomized control trials and in these meta-analyses, if you break it down to individual data points, you'll see people all over the place for side effects, for response, for a million different variables. So yes, the average trend is helpful, but there are exceptions. And that's why you don't see response across modalities beyond exercise for any intervention and beyond even depression. Even if you're looking at things like schizophrenia, a drug that mechanistically should block dopamine and have X effect doesn't always, because people are different. So I think we have a very oversimplified lens sometimes, and then we're surprised why treatments don't help 100% when, again, we have to remind ourselves that these are individual people with individual responses, and it's important to tailor it as such.
Do you prescribe like specific exercise to people, or is it just, hey, I just want to make sure that you're like just getting some sort of form of exercise, or do you tend to try to balance it out and prefer any type of exercise?
Yeah, it's a good point you bring. So when I talk about prescribing exercise, I do it the same as I would a medication. So I think most patients that have been speaking to their doctor about exercise probably get the general, you should exercise. Probably not even for mental health. It's probably for weight loss, for diabetes, for whatever metabolic ailment. Usually it's what it's suggested for. And I find that the general recommendation of that is not super helpful, especially for someone that doesn't know how to get into it. It can be almost condescending to say, oh, just exercise. They knew that already. They know that's something that would be beneficial. What they need is someone to help them. And this is the caveat being, if they want to hear that discussion first. You don't just throw this in someone's face. You have to invite that, see if that's something they want to talk about first. So when you prescribe a medication, and we can talk about an antidepressant, you would pick the medication, you would pick the dose, you would pick the route, you would pick how often they take it. You wouldn't just say, take this medication or take antidepressant. That would be akin to saying, go exercise. That's the same thing that physicians say. Not all the time, but a large majority. So instead, you can break it down. We published a paper on this. It's called the FIT framework, or FITT. So it breaks exercise down into its own sort of prescription too. So F is the frequency of exercise. So how many times are you exercising per week? I is the intensity. So that can be low, that can be moderate, that can be vigorous. And in general, we measure that just using the talk test. It's not an official test or anything, but the general sense is that if you're able to have a full conversation, you can sing, do everything with your friend there, probably low intensity. If you can talk, but it's getting a little bit more difficult, you can't really sing, get all of that air capacity out, it's probably more moderate. And if you can't talk at all, you're probably more to vigorous intensity. The other T is the timing. So how long are these exercise sessions? Are they going to be 10-minute bouts of this high intensity, like HIIT sort of stuff? Or is it going to be a longer session that's an hour or even longer than that? And then the last one is the type, which is the largely divided into aerobic, which is things like running, resistance, which are things like weight training, and then mind body, which are things like yoga. So you can use that format to effectively prescribe exercises you would, similar to a medication. And the biggest factor is start low, go slow with it. And the same principles for medications. But you also want to pick something that the patient wants to do. So if they say, back in the day, I was a runner and I actually really enjoyed that, but for whatever reason, your bias is resistance training, you should go with what the patient wants to do, because you can prescribe someone the best exercise routine or whatever by the books. But if they're not doing it, it doesn't matter. The same thing applies for diet. You can prescribe someone the best diet for depression, for weight loss, whatever it may be. But if they're not doing it, it doesn't matter. So the goal is adherence. So you work with them to find something that they want to do. You start low and you can follow that exercise prescription. You can put in your note the FIT principle. You can put what you prescribed akin to a medication. You can titrate it up akin to what you would do for a medication too. And you can also, oftentimes clinics, you track depression scores numerically as well too. So if you want, you can track that as well with the corresponding FIT principle. So similar to a medication, you can prescribe exercise and you can track the response as you would with a medication too. So it's important for providers to feel comfortable speaking about this. And you don't need to be perfect about how to talk about what, but again, just following the general principle of starting low, going slow, seeing how that helps their depression, other physical ailments, other mental health stuff going on, and just following it from there. And again, making it more structured than this just general sense of exercise, because I think that can be very condescending to someone. Because again, people are smart. They know that if they were moving or something, it would be better, but they just sometimes don't know how to go about it. And that can be very overwhelming.
So for yourself specifically, knowing what you know about mental health and exercise and physical activity, what do you try to prioritize for yourself? Is it more so resistance training, or do you try to do like a kind of a combination of all of them?
I would say out of my own personal preference. So as I mentioned before, I did a lot of soccer before. I was never a huge cardio guy though, surprisingly. So after I found, just timing wise, I found, especially during medical school and residency, at first I was playing in a few soccer leagues and stuff like that, but it was very hard timing wise from work. And some of these games, as you get into these men's leagues, are at like 11 p.m. at night. And I'm not about that. I like to sleep too. So I found I transitioned more to resistance training because it was just a lot more accessible. So I just liked the weights. We have gyms at our hospitals and everything too. So even if I have a really busy day, I can still go to the gym there, get a nice session in, and go home, or do it in the morning before I see my patients. So I found that there was a lot of flexibility with that and that I just enjoyed it more. So I stuck with that. I still do try to run here and there. I am by no means a runner. I would say I resistance train a lot more just because, again, I enjoy it. It's something that I look forward to. It's a time where I can just put on some music. I actually prefer just to work out alone, and just that's my time just to think. Sometimes I just shut my brain off completely. Other times I come up with a lot of my research ideas while I'm just working out, because it's a time where I don't have to worry about other stuff. I'm just thinking. And surprisingly, when you just give yourself the space to think, that's where the ideas come. So a lot of my threads, a lot of my papers are when I'm just at the gym. I just have a little notepad. I'm like, oh, that's a cool idea. And then I think about it, sort of thing. So yeah, I guess that's a long-winded way to say my primary modality is more like weightlifting with a little bit of cardio. Again, by no means an expert there. But again, it's because that's what I like. And could I optimize it more? For sure. But I think maybe I wouldn't like it as much then. And maybe it wouldn't become this thing where I'm motivated to do versus something that is now I'm just trying to stick to some guideline or stick to some optimal sort of protocol. So it's the same principle that I apply to my patients. It doesn't have to be perfect. You do what you like thing, and you'll see results both physically and mentally from that side.
Yeah, no, that's awesome. Yeah, those men's leagues, like I play hockey, and I won't play during the week for that reason, because I'm like, I'm not going to play 8 or 9 or 10 o'clock at night. There's just no way that I'm going to do that. So I totally understand that there. I will say, you said you didn't really like cardio, but you played soccer. That's cardio. To me, that's a ton of cardio right there, right?
Yeah.
So for you, with being a resident and stuff like that, how do you make the time for that? Is that a struggle, or are you able to stick to a pretty consistent routine there with that? Or is, again, it just, I know you said you have a gym, you have access to a gym, which probably makes it a little bit more easy for you, but are you able to stick to like a sort of consistent routine with that, or what does that look like?
Yeah, obviously it varies a little bit. So I'm fortunate in psychiatry, we're a little bit, or not a little bit, a lot less busy than other residencies like surgery or internal medicine and stuff like that. So I have a little bit of more of the luxury of time from that side of things, at least in residency. But I do find that even with that, it can still be hard to prioritize stuff. So I always make sure that is my priority. So every single day I'm going to do that no matter what, or not on rest days, but I try to work out 5 days a week sort of thing with weightlifting. And I do that by just saying, if I have an opening in my schedule, I will make sure I do that. So whether that's before work, whether that's after work, I always make sure that I have that slot just to get my workout on and everything from that front. And sometimes you have to be very dynamic with it. So I'm right now working in an outpatient clinic. So sometimes we have patients that don't show up, and then I'll have a 1-hour block in my schedule that is just now open. Since I have the gym in my hospital, if someone doesn't show up, I just go to the gym then. And that saves me time later on in the day if I have other work to get done. So I think as a resident, it's very key to be able to be dynamic with when you're able to work out and flexible with that, because we also work 24-hour call shifts sometimes too. So I try not to work out on those days because recovery is important too. And I don't want to completely exhaust myself and then not recover, injure myself, sort of thing. So I draw a line on when I'm on call. Even if I have the time, I won't work out. I just would prefer to focus on being on call and stuff like that. But again, just being very flexible, but also prioritizing your own physical health, because it's very easy to get in this cycle. And this is something that I found in medical school is when I started, you're overwhelmed with all this work. You go from undergrad to now you have to learn all of medicine in 4 years. So initially I was just studying a lot. I was just on the grind. I wasn't really taking care of myself. And then I thought of, this is not what I want. Like, I don't want to be in this cycle. And from there, what I did was started taking care of myself more, started going to the gym, started eating better, and I had a lot less time to study. But I found that with that, my marks actually went up. I was doing better because I was taking care of my own cognitive health. So that's something that applies here too, because with balancing clinical duties, research, even writing threads and stuff like that, it's a lot of time. But if you're prioritizing, your own brain works better. And that's through some of these lifestyle habits. So you're able to actually get more done. So you have to break that cycle of work. You have to take care of yourself, and you'll actually notice indirect benefits to what those initial goals were. And I think, unfortunately, it's just how residency is set up, where lots of people, it beats you down. You're on all these call shifts, you're working so many hours, you have to study for your exams still. So it's very hard. And again, I emphasize that in psychiatry, it's easier than other residencies, but nonetheless, it still has these 24-hour calls and stuff like that. So just prioritizing that and making sure you keep that in the forefront of your mind to move forward.
Yeah, no, I think that's awesome because again, like part of the reason I wanted to bring you on here is just to just let people know like the importance of the mental health and brain health side of things, right? Like in your situation there, where it's like you're studying, you're trying to get through medical school, all these things, and it's hard. It's easy to get into that cycle, like you said, where now you don't exercise, and I don't think people fully understand that will impact your ability to, like you said, think, get through the day, all those things. And I think that, again, I think that's super important to, again, it's just a catch-22 where it's that just vicious cycle, and you just have to find a way to break that up there. So you did mention something on X a couple months ago, maybe it was even more recent than that. And I thought this was super interesting about exercise intensity and mental health. What were some of the things you found there? Is there anything that people need to know about that? Because we just got done talking about, hey, you just need to do something, what works for you, what you enjoy. This is super important. But where's that kind of association between exercise intensity and mental health?
So in combining the trials that have looked at different intensities of exercise and antidepressant effects, there's a general trend to the higher intensity being corresponding to higher antidepressant effects. And again, there's nuance to this too, because in these trials too, you can imagine that there is a little bit of a bias for people that can or have the capacity to exercise to a higher intensity might represent a healthier population, and thus also might have a better response to exercise, or even at baseline have a predicted better response or an antidepressant effect to exercise. So in general, that's what the literature shows, where the higher intensity that you work out, the greater the antidepressant effect. But again, I mentioned before too, that curve of from going to sedentary or not moving at all to just moving a bit, you see a drastic increase in that antidepressant effect, and it kind of tapers off. So although the association remains where higher intensity is generally better, it's one of those examples where, do you need to strive for perfection to have the benefit that you would almost reach without going full out? And there are nuances to it as well too, particularly in older populations. Sometimes that association doesn't hold true because the physical demands of their body, so we're talking about people that are 65 plus, exercising at a vigorous intensity might actually be harmful to someone, where if you have pre-existing cardiac conditions or you're just physically frail from getting older and older, that perhaps being at a mild or moderate actually does better for you, rather than sustaining a bunch of injuries, not being able to work out the next day, and entering a cycle of sedentary behavior from injuries. So in general, intensity increase is greater antidepressant effects, but there's a lot of nuances, and I also don't always strive for that to be the goal for someone in front of you, but it's great if you're able to do that and if you are able to notice that, because even beyond antidepressant effects, immediately, anecdotally, you can notice when you have a very intense workout and you have a good session, you can immediately notice those cognitive changes. And sometimes those can persist if you're doing that over and over. But again, by no means is it necessary.
Yeah, no, that's a good point, right? It's like we're not striving to just train as intensely as possible all the time. Like you said, there is a little bit of this, hey, if you can, not everyone's going to be able to train super intense. I'm sure some of it is all relative to that person as well too, right? Where like intense for one person is super easy for another person. And so it all is very relative to that person and their current fitness, health, and everything like that. Cool. Okay. So does that change anything like for you specifically, or is it like, hey, maybe every once in a while we do want to try to, if you're already exercising, you're already doing it, you can get to that point. It's probably a good idea to make sure that if you can get your intensity up from time to time, if you want to really reap, like you said, cognitive benefits, mental health benefits, and things like that.
Yeah. If you look at either extremes, if you're doing very low intensity exercise all of the time, for sure you're still going to have those benefits. But if you compare that to someone who is really engaging in a strenuous exercise, so if you compare just to like mild walking for 10 minutes to a full marathon or training for something like that, there will be differences in terms of what effects you notice. And I think in general, it's great to motivate people to getting there. But again, not also emphasizing that this needs to be your goal of if you're going to start running or sorry, walking, you need to run 40K now. If you can get anywhere in between, that's great. And I think the general thing is if you can progress, that's also great, but you don't have to too. I think when there's, for some people, particularly with depression too, when there's this expectation of need for progression, that alone can be off-putting because if you have 1 week where you walk 10 minutes, the next week you walk 8 minutes, they're like, I've already failed. I don't want to do this anymore. So the emphasis again should be more on adherence and allowing that patient to feel that they have ownership over their own decisions there, and you're just there to help guide them. So in an ideal world, progression from an intensity perspective is great, but you can also go further with some of the other fit principles. So timing, frequency. Say you go for a 10-minute walk each day. You did it once a week. Now you do it twice a week. Or the 10-minute walk is now 15 minutes or even 11 minutes. These small changes slowly accumulate over time, and especially at the beginning where it's just hard to get into whatever exercise you're doing. I think, again, emphasis is just on increasing it. It doesn't have to happen, but that would be great. And we don't need these end goals to be absolute either.
Yeah. Awesome. Cool. Let's talk creatine. That was, again, I think anybody in my audience is well familiar with creatine at this point. And so I think how I want to start this is just, you had a paper recently on creatine and depression, right? And mental health and everything like that. So I guess maybe what led you to wanting to write that paper and diving into this a bit more?
Yeah. So again, from my own just personal experience, I'm someone who's taken creatine for almost a decade now, more so from the lens of working out. And as you mentioned, your audience is probably more familiar with it from the lens of improvements with weightlifting, improvements with running, all these different more physical factors. But, and this isn't even necessarily a novel topic per se, but it was something that was noticed, the cognitive benefits of creatine. And with that, it makes sense to see the extension of potentially this links to depression as well too. I believe even back in 2011, they did a trial where they compared or they added creatine to an antidepressant agent. And they noticed a improved response, so a quicker response at 2 weeks. And then at the end of the trial, at 8 weeks, they noticed also an improved antidepressant response. So this is important for two reasons. Antidepressants alone, they usually take 4 to 8 weeks to have that optimal effect. And that can be a long time for someone who is experiencing a debilitating depression. So if there's something that can be used to help improve this response or improve even the end response, that's pretty promising. And more recently, they also paired creatine with cognitive behavioral therapy, which is a therapy used for the treatment of depression, anxiety, a lot of different mental disorders. And similarly, they found an improved response. My thought with that was that it was more linked to some of perhaps the cognitive benefits that allows you to engage more in therapy and get more out of it. So these things were very exciting for me to see. So we wrote 2 pieces. So we actually wrote a response at first to the therapy trial that came out just in 2025, piecing together some of the trials that I just discussed. So about antidepressants with therapy. There have been a number of other trials pairing it with antidepressants for depression, which showed very similar results. The therapy one is the only one that exists. But what we noticed is that there's a missing link where we've spoken about how exercise, it has similar antidepressant effects to medications or therapy. And we know that people who exercise regularly take creatine, but there isn't a study that's looking at pairing exercise and creatine for the treatment of depression and comparing it to placebo or comparing it to another treatment. So there was a gap in the literature. So that was the initial piece that we had written. And then the second piece that we had written was speaking more to the bioenergetic lens of what creatine may be doing in the brain. So an increasing view of the brain, before a predominant view was depression and serotonin, low serotonin is depression. I think it's a very well accepted fact now. That's not necessarily the case. Being depressed isn't just due to low serotonin levels. There's a multitude of other factors. Low serotonin can be there, but we know that these antidepressant drugs aren't just working via serotonin. There's a lot of other things going on. So there's been increasing interest in more of a what we call bioenergy view of the brain and mental disorders as well too. So the brain, it only weighs about 2% of your whole body weight, but it takes about 20% of the energy of your body, which speaks to how much energy is required to just allow your cognition to function. With creatine, we know that when you take it, the majority of it's stored in your muscles. So about 95%, it's stored as something called phosphocreatine. Some of it goes to other organs, but for the sake of discussion, we'll say the other 5 goes to the brain. Similarly stored as phosphocreatine. And what the thought is that in times of increased metabolic demand, so that would be things like depression or even things like sleep deprivation, what your body is able to do is it's not functioning properly. So we speak of something called oxidative phosphorylation, big fancy word for how your body usually makes ATP or energy. And when you're having these increased metabolic demands, it's not doing that properly. So you can have downstream dysfunctions. And what the creatine is able to do is you can tap into this quick energy reserve, akin to how your muscles use it, where you can have ATP being rapidly or energy being rapidly regenerated via this creatine circuit rather than relying on your primary circuits. So the problem is, though, for people that just eat a regular diet and stuff of that sort, to get what you get in 1 scoop of creatine, which is 5 grams, you need to eat about 3 pounds of red meat, which is quite a bit. So if you're 1v1ing someone that's taken supplemental creatine versus just their diet, it's going to be hard to really compare the two. So the thought is that if you're supplementing creatine, that you have some more of this kind of backup energy reserve. So if you're in a sleep deprived state, if you're in a depressed state, you're able to just function a little bit better. By no means is it a cure. You can imagine mechanistically, this is not going to cure your depression or anything from that sort. But when paired with some of these other therapies, maybe it lets you engage in exercise more. Maybe it allows you to engage in therapy more. And we have seen that from that study. So the thought being that by restoring or helping with some of these dysfunctional bioenergetics, the creatine can also help with the depression symptoms. Because as we mentioned, depression is one term, but there's so many symptoms and so many different ways that it can be combined that perhaps creatine has a role here. The problem is creatine so far in most of these studies has been supplemented at only 5 grams per day because that's often what in fitness. Recent research, and there's not a lot of trials, and Darren Candow, someone where I'm actually working on a few papers with him, he was on Rhonda Patrick's podcast recently, has spoken a lot about how perhaps we need a higher dose of creatine, and we mentioned this in our paper too, so maybe around 10 or higher to start seeing actual brain changes. And maybe we need to see this being taken for longer as well too. So a lot of these trials, they're only up to 8 weeks, but perhaps we need longer to see real brain changes. So the thought is that over time, hopefully we start to see trials that are using higher doses of creatine for a longer period of time as either a supplement to medications, as a supplement to therapy or things like that. And then hoping to see what the antidepressant effect is there via increased creatine in the brain. And again, and helping with the brain bioenergetics. So that's a thought behind creatine where it comes in. By no means is it this fix-all for all mental disorders where you give someone 10 grams of creatine and everything's fine, but it's a very low risk, it's a very cheap supplement. And from my lens of things, that makes sense. It's the same thing as exercise. It's time is involved, but it's quite a low risk. It's beneficial to your mental and physical health. And again, it's not going to cure all mental disorders, but even for schizophrenia, for someone for exercise or creatine, you're going to see likely benefits from that. So it makes sense as an additive therapy. So I'm excited to see more trials come out, and we're working with some people to set up some grants to set up some of those exercise ones as well too. So hopefully we'll see those in the future, but I think it's a very exciting area. And I think it's a very promising intervention.
No, that's awesome. I think I was going to ask you. So again, it's not a cure all, like you said, right? But it's a low risk, high reward type thing supplement for all the reasons you mentioned. And it's funny because like you said, it was initially there to help with like strength and body composition and stuff like that. Right? And I would say the same thing a few years ago of, hey, it's a low risk just for that, a low risk, high reward just for that. But now I feel like over the last couple of years, it's really picked up in terms of extra benefits and everything like that. And so now it's okay. Now it almost makes sense even more so than what I said, just for the hypertrophy and body comp and strength benefits there. Cool. So a couple things that you mentioned too, there was a lot I want to dive into there. So first you mentioned, hey, most of it's going to get stored in the muscle, 5%. And you said the brain. I know you said there's some numbers that could be off a little bit there with that, but so does that mean, will the body prioritize the muscle stores over the brain stores, or is that necessarily how that works out? Is it like an order of operations thing, or what is that kind of?
Yeah, so there's a lot more transporters for the muscles. So because of that, most of the creatine that you're ingesting is just going to go straight to the muscles. It's almost like that leftover that once the muscles are saturated, then there's room for that extra creatine to go to the brain, which again has a minimal amount of receptors expressed for that transport, which is why the thought is that you need a higher dose and a longer time to really see brain changes. Whereas with muscles, there's a variety of different dosing protocols. Some people load it for a week and then they just take 5 grams a day sort of thing. And the thought being is within those weeks, you reach quote unquote saturation. And right now we don't actually know what you need for the brain in terms of a concrete protocol or what is required to increase brain levels, because An example is recently a paper actually came out looking at creatine and sleep deprivation, creatine levels, so not supplementation. The thought would be that after you're deprived, your creatine levels would actually be decreased. And that's why supplementation is helpful. But in this study, they found that it was increased. There's not necessarily an explanation for that. And I don't necessarily have that right now either, too. So I think it speaks to the nascent field of creatine, even though it's been around so long from the physical side of things and even some of those cognitive benefits. I think we're only really starting to get into what is actually happening in the brain. So it'll be exciting to see that mechanistically, but I also think another lens of it is just clinically too. Even if mechanistically we don't know exactly what levels are changing in XYZ, there's a lot of benefit to see clinically, is this helpful for someone that has a depression? An example is even antidepressants. Even though we know that they change serotonin levels at all these different neurotransmitter levels, that's probably not the only thing that they're doing, because as we know, depression isn't just low serotonin. So there's something else happening, yet we do still see benefits for people's depression, anxiety, and stuff like that. So it's very similar to creatine, where right now we don't know everything, but it seems to be promising. But again, we need more research to really back some of these findings. And a lot of it is more mechanistic thoughts of what is likely happening, but we need to really delineate that.
And this, again, like you mentioned, that this is where the thought of, okay, hey, because the fact that it's mostly found in muscle, and again, like that's where the thought of, okay, now we need to ramp, like we probably need to be at a higher dose than say 5 grams to potentially get that. But what it sounds like, we don't know for sure what the dose is that you need to have to really get those benefits, and fully understanding what exactly is going on. There's some thoughts, like you said, you had your paper there where you said bioenergetics of the brain, but really the actual like mechanistic type things, we don't know for sure what exactly is going on there yet. And that's where we're exploring. But we can use, because this was one of the questions I felt like came up a lot on your Twitter around creatine, was the side effects, right? And this is where now you can rely on, I'm assuming, that research of, hey, they've looked at doses all the way up to 10 to 20 grams and didn't really see any side effects long-term there with that.
Yeah. And from side effects, there's a lot of things that come up. So obviously, I can't speak to individual people and want to be careful to say about anything for recommendations, always to speak to their doctor. But common things that you see come up are things like, with creatine, what happens to my kidneys, sort of thing. So that's a common one that you see. And there has been literature to show, and actually I should speak about where this came from at first. There was a case study, I believe, of an athlete that was exercising. They were also cutting weight as well, too. And with that, you're dehydrated. I forget how much creatine they were supplementing, but it was higher than 5 grams per day. And what they found was elevations in some of their markers for kidney injury, so their creatinine levels. There's multiple reasons for that. So creatine artificially will increase your creatinine levels, which doesn't necessarily represent kidney damage. In this case of the case report, though, perhaps there was something called like an acute kidney injury happening because of dehydration. And we know that when you're not perfusing your kidney as much, stuff like that can happen. So it's hard for me to make judgments of that specific case report, but that's a thought process around there. But that's what really perpetuated the literature about fears around kidney damage and creatine levels. And what we can say is, based on large meta-analyses, which is putting the studies together at the lower dose ranges, and again, most of these are around 5, 10 sort of thing, not super high for a long period of time, they found it to be relatively safe for kidney function. Again, this is based on averages. There are exceptions for people with different medical conditions. And by all means, if you have pre-existing kidney impairment or any reasons or any other medical ailments, for sure speak to your doctor first. But just to speak to the literature to say that this creatine at these doses has been seen to be relatively safe, but it is a case-by-case basis. So to make sure that that's a discussion. Another side effect that you often see is hair loss, and people being very worried about that. This also came from a smaller study, I believe, of rugby players, and they had supplemented creatine, and then they found an increase in their DHT levels. This is essentially a hormone that is associated with hair loss, and people take medications to lower these levels, like finasteride, to prevent male pattern baldness. So the thought was that because this was seen, that creatine will lead to hair loss and all of these side effects, and it created this kind of whole scare around there. Since then, they've done a lot of other studies trying to replicate this, and to my knowledge, they haven't seen a similar sort of pattern. And they actually did a recent randomized control trial that I haven't had the chance to read the whole thing, but what it showed was that creatine didn't actually lead to hair loss. And I can't speak to all the hormones and everything from that side because I haven't had the chance to read the whole paper yet. But again, I don't want to discredit people's individual experiences because lots of people say, when I take this, I've noticed my hair falling out. But from what the literature says in a broad sense is that it hasn't led to hair loss and stuff of that sort. But again, it's not a space from the hair loss side of thing that has had this robust evidence. There have been studies that show it. So I don't want to discredit anyone's individual experience, but at the same time, just presenting the literature as it is right now. And more trials will hopefully come out from that side of things. And then the other thing is with creatine, a lot of people talk about weight gain, and it makes sense. So a lot of the weight gain that you see is initially, because it is an osmotic agent, you get water retention in your muscles. So depending on how much muscles you have, how many muscles you have to start with, you may see a considerable amount of water retention. So you can see 3, 5, or some people even notice more pounds of weight gain within the first few weeks. And not to be alarmed, because what people have found is sometimes splitting the dose or taking lower doses throughout the day can actually lead to less water retention. And other people have also noticed that over time, after they have this initial kind of loading phase, some of that water weight comes off. The other thing is too, if you just stop taking creatine, you'll lose that because that osmotic pressure to draw water in is no longer there. But it's something to be aware about, because weight is an important topic as well too for lots of people. So just to be aware that there will be likely initial weight gain from water, but also muscle mass too, if it helps you perform more.
Yep.
So things to be aware. So those are some of the common side effects that I've heard a lot. So it's mostly the kidney and hair loss sort of thing. But yeah.
That's interesting on the kidney. Again, it just sounds like, and this is maybe where I feel like the myth years and years ago was like, oh, you need to drink more water or whatnot. So again, you're looking at other things that could potentially be going on there. So again, staying hydrated generally is a good idea for overall health, but also like you may run into some potential issues there if you're like super dehydrated. Obviously, that was an extreme example there with that. I recently, with all this, again, I think it was a couple years ago, I first initially heard about the sleep deprivation, which I thought was super interesting. And that led me to be like, but then I looked into the research and it did look like that was like a higher dose. And I feel like as more of these kind of cognitive benefits came out and mental health benefits, it did seem, hey, it was going to be a little bit higher, but I never really decided to increase the amount of creatine that I take. But I recently did, probably 2 weeks ago, I bumped it up from 5 to 10. And I did right off the bat notice a little bit of more gas than normal. And I took it all at once. And so again, just from my experience, probably would be better, like you said, to split up the dose to help with that. But I have also found that to go away. I don't really experience that anymore. And like I said, I started doing that 2 weeks ago. So just like an anecdotal experience from that. But as you said, everyone's going to respond a little bit differently to it there. I was actually surprised because I think I shared your specific study with my audience on Instagram, and I got a bunch of questions on it about how much. And I was surprised that I thought there was more data on like they dose it based on body weight, but it seems like it's just these kind of standard doses that they'll give people mostly in studies. Is that correct?
Yeah, most of the studies, especially in the mental health realm, and I think to the physical health realm, because of how we see dosing, is more of the 5 grams per day rather than body weight. I think it's more for ease. Interestingly, though, one of the sleep deprivation studies that you mentioned did use it as a body weight dosing, and they gave a pretty hefty dose. So they gave 0.35 grams per kilogram, I believe. So that's a pretty big dose it was a single dose, so this isn't something repeated, but they found benefits to someone's cognition following 21 hours of sleep deprivation, which, again, it's similar to being a resident. Like, we do that pretty regularly. Personally, I don't find that I take a big dose like that pretty frequently. What I've done is I've also increased to 10 grams a day. I take it split in the morning and then at night. And then if I am on call or post call, I'll add like another 5 sort of thing just to help. And again, do I know if it's placebo or if it's helped? I feel like I've had a little bit more of kind of cognitive reserve, because if you've ever done a 24-hour shift or an overnight shift or something like that, your brain is just not functioning and you're having to make important decisions, right? Because we're in the hospital, we're seeing people. So to me, that's of utmost importance to make sure that I'm physically and mentally present. So if anything can help with, that's great. Obviously, if the culture can change, that would be better. But with what we have now, I think if that is an area for intervention, I think it certainly could be beneficial.
So you mentioned with creatine, it's going to have the most cognitive and mental health benefits under, I can't think of the exact word you said, but basically like sleep deprivation. I think I saw like oxygen deprivation, depression, things like that, high stress. Is that the only time that you'll see those types of benefits? Or do you think you could also just, maybe you aren't necessarily sleep deprived, but you do want to get a little bit more cognitive support, whatever that may be, for work or whatever it may be? Will it still work then? Or do you think that most people probably have some sort of stress going on, some sort of sleep deprivation, so it doesn't really matter anyways? But I'm just wondering if you'll still see that benefit there.
Yeah, no, they've done studies, individual trials, and also bringing these trials together in meta-analyses, looking at cognition, even in a non-sleep deprived state, and they've seen benefits to that as well too. So it's not these massive benefits where you're going to suddenly become some super genius solving world problems, but it's these subtle benefits to your concentration and different features that can be helpful. And again, it goes back to the depression side of things too, where we know that there are deficits in this. So certainly creatine is helpful in these times of sleep deprivation or depression or any of these metabolic demands. However, even in times that's not happening, it seems that there are benefits. And it's a good point that you made, though, too. I think the population nowadays is probably chronically sleep deprived or is chronically tired for another reason. And there is an increased metabolic demand for whatever reason that may be. And that can be due to coexisting physical health conditions. That could be due to just having a rough night the night prior. There's a million different reasons that you're not operating at 100%. And again, not to say that creatine brings you to 100%, but it's like that buffer. And you can look at it the same as in the gym. You get more reps with your brain. You get more reps. You just have a little bit more reserve is how I like to see it. Not going to solve all, not going to cure all, but it just helps a little bit.
Yep. Yeah. As I was asking that question, I'm like, at the end of the day, probably most people do have some sort of metabolic demand going on anyways, even if you don't feel like you do. Okay, cool. So I guess then where to go with this. So a few things, because I saw a lot of people were asking about types. And then I guess real quick before we go into that, what was I going to say? So let's start with that. And then that thought will come back to me. So what are we looking at in terms of types of creatine? Oh, this is what I was going to say. So again, it sounds like if we're looking at the cognitive benefits, mental health benefits, this is again going to lead to, it might take a little bit longer to get there. So like you need to be patient with it. And again, creatine generally, I always tell people it's the opposite of caffeine, right? You're going to get that acute feeling of taking caffeine, right? Whereas creatine, you need to let it saturate. It's going to take a little bit of time to really see those benefits and you need to take it consistently. But it sounds like if you're looking for the cognitive benefits, we're almost looking at potentially that being longer than it would be even just for the muscle side of things.
Yeah, and that's the thing. We need more research to really delineate that, but we have a lot of literature for the muscle health, saturation, and stuff, and cognitive benefits as well too. Is oftentimes there are trials where people start it and they see that, and you do see benefits initially as well too, but perhaps it takes a little bit longer, as we discussed before, to see some of those brain benefits, whether it's depression, whether it's just cognition in a healthy population. But again, to be patient. And then again, not even operating in isolation. Oftentimes creatine is used with exercise if it helps facilitate that. There's a large body of literature to show exercise's benefits on cognition. So even if we're not looking at direct associations via just creatine, what it may allow you to do or do in the gym more of, you'll see benefits from that lens too. So there's a lot of different factors that come together for that improved cognition, which are important to take into account because oftentimes we get very lost in the literature of RCT, you get this supplement, you get this results, but in the real world, you take this supplement, you go to the gym, you have a busy work day, all these different things come together. And I think that's important to take into consideration because you can have all these fancy brain imaging scans and all these different fancy randomized control trials, but then when it comes to real life, all of these variables come together. And we know that there is literature to support a lot of these different things from a brain health perspective, which is why it might be helpful.
And then as far as forms, again, I know the most researched is monohydrate. Is it, again, same thing for the mental health and cognitive benefits as well too?
Yeah. So yeah, pretty much all of the studies I think in mental health for depression have been on monohydrate. And people often ask about HCl or even nitrate. And to be honest, I would expect the effects to be the same, but I don't have the trials to back that up as well too. There's so many things where you would expect it to be the same, and for whatever reason, it's not. Monohydrate just means that it's bound to a water molecule. The other ones are bound to whatever the word beside them is as well too. The thought is that HCl sometimes for people that are having difficulties with digestive issues, whether they're feeling bloated, they're getting an upset stomach. Sometimes people have said HCl is a little bit easier on their stomach. There's also arguments that you need a little bit lower dose of HCl than you would need for hydrate. And I don't even know what the conversion is for there. I've just stuck with monohydrate and in my discussions with people too. And then nitrate, to my knowledge, is one of the more expensive ones. It helps with digestion as well too. But with being bound to the nitrate group, it helps with some of the vasodilation and like the pump that you get at the gym sort of thing. So it's probably the more expensive one, but most of the literature, mental health wise, cognition wise, is monohydrate. So my recommendation would be to stick with what the literature says now. If we start having trials looking at these other ones, then sure. But there's been crazier things that happen in medicine when you make a small change on a compound and you don't see that result. So that's not a game I would play with. Again, although I assume the active part of creatine is doing this, we've seen crazier things where you make a small change from the main drug to the non-brand name drug and you don't see the same effect. So I think with that, I think the safest bet is to stick with monohydrate. And if we want to stick to the literature as close as possible.
And it's cheaper. Now, I always say that, and I've never actually looked at
Mhm.
the price difference. I don't know what that really
Mhm.
looks like there, but it sounds, again, if we're going off the research, like most of the research is done on monohydrate. Like you said,
Mhm.
could it change things? Probably not, but it still may change things if you change the form that you take it. And then essentially you're looking at potential vascular benefits of like nitrate and some like GI distress, lower GI distress with HCl and
Mhm.
nitrate. Potentially, again, it sounds like it's more so based on what people like get mixed results from that. But again, you're paying a little bit of a higher price point there with that specifically. And again, I think if we come back to how to take it, like potentially splitting up the monohydrate throughout the day could be a way
Mhm.
to work through that as well too. And again, with anything, is there like the repeat about effect of taking creatine to where a lot of these side
Mhm.
effects tend to go down as you do it longer,
Mhm.
right? I saw in
Mhm.
my situation, which again is just anecdotal, it's just one thing there with that. Who would you say needs creatine the most?
Yeah, it's a great question. I think it would best to be looking at it from like a dietary standpoint. So as I mentioned, most creatine comes from red meat and fish. Again, some of your body is able to make creatine as well too. You make about 1 to 2 grams per day. But from that lens, I think people that would benefit both, I mean, most, but we need more literature on this, is probably people that aren't getting as much from their diet. So people that aren't eating red meats or aren't eating fish. So whether that's like a vegetarian or vegan diet. And they've looked at studies looking at, I forget if it was vegetarian or vegan specifically, but looking at their muscle creatine levels. And I believe they had around 30% lower amounts of creatine, which makes sense. And again, if a lot of these benefits are mediated via creatine, this is a population that I think would benefit the most. However, again, we need more research. There's not a trial looking at people with a specific dietary pattern, giving them creatine and seeing what the depression outcomes are or what the cognitive health outcomes are. We know that there's lower levels, but we don't necessarily know what that transfers to. So I think from a strictly mental health stance, that's probably where we would see the most benefit. But I can't say that 100% backed by a trial to say that right now.
And would you say sex differences with this too? Would there be anything there? Again, it sounds like there's
Mhm.
no research on that, but would you say there is any sex differences in terms of, hey, maybe women generally need more, or is that
Mhm.
something that we just can't say at this time?
Yeah, so it's a small signal, but if you actually look at the initial creatine trials for depression, they're actually all in women because
Interesting.
the signal was that perhaps there was an improved response in women. And sometimes what you want to do is when you're setting up a trial to set up other ones, you want to see a good outcome to say, okay, this is worthy of now investigating in another population. Since then, in the most recent trial in cognitive behavioral therapy, I believe it was a 50-50 split between men and women, but the thought is that perhaps there's a benefit more so in women, and maybe that's due to a proxy of less red meat intake and stuff of that sort, whereas men, you're eating more calories and such. But I don't think it's a very clear signal where you're going to necessarily get way more benefits from that side of things. But nonetheless, of the history of the trials and how they were set up, that's what we saw at the beginning. And I think that's what their thought process was at the beginning too. But everyone will benefit from that front. And I think more traditionally too, we've seen it as this sort of like gym bro sort of thing. And that's why you probably see a lot more guys that were taking it to start with. But I think it's being rebranded now where more females are taking it, whether it's for exercise, whether it's for mental health benefits, whether it's for cognitive health benefits. And it's reassuring to see that too. Long winded way to say that I don't think that there's necessarily a clear winner, but history wise, I think there was at least thoughts around that.
Is there anything we missed on like the cognitive or mental health side of things in terms of creatine supplementation? Anything that you can think of there that you want to add or anything to that?
I think apart from depression, not so much. There are a handful of trials looking at other conditions as well too. So there's some trials looking at schizophrenia, PTSD, and they're not full like randomized control trials, these big sort of things, but they've noticed benefits to whether it's cognition or symptoms of schizophrenia from that front. So very small signals, but I think it's exciting area to see for across mental disorders because if you've seen the DSM, the book is a lot bigger than just depression. There's a lot of areas where there may be potential for it. And again, not to say it's some cure all, but perhaps it can be beneficial because an example would be schizophrenia, where that's a symptom where someone is experiencing what we call positive symptoms. So that is hearing voices or seeing things. That's easy for us. We're good at treating that. We can stop that from happening. The hardest part to treat are what we call the negative symptoms. So that's where there's a lack of motivation, where there is cognitive difficulties that persist. And we spoke about creatine from that one. So maybe there could be a role for creatine to help with that. Again, not to cure all of this, but if we can help to a point where cognition is improved or energy levels are improved, that might be beneficial because, again, we don't have, despite so long and so many trials, great treatments for these negative symptoms. So perhaps this is something where it could fit in there too.
Well, and real quick, I never really hit on the cognitive versus mental health. Is there separation there with that? Or would you lump those together in a way?
Yeah, I guess it depends on who you speak to. For myself, I would lump them together, to be honest. Across almost any mental disorder, there's going to be some level of what we would call like cognitive dysfunction, whether that's memory issues, whether that's concentration difficulties. There's a variety of different factors that are affected because your cognition and mental health are directly related, and some would argue are pretty much the same thing. So I think it'd be tough to really separate the two. If you're doing formal tests and things for a trial, they would be on different questionnaires. But even with that, they would overlap. Like depression, a feature of it is concentration difficulties. So if you're testing someone's cognition and someone has concentration difficulties, those overlap. So they can be perceived as separate, but they're pretty much the same.
Gotcha. Okay. Yeah, I just didn't know if there was a difference there in terms of if we see the benefits, if anything, yeah, it just is different there. But super funny with creatine. It's man, I could be wrong here, but has any sort of like supplement or anything like taken such a 360 turn or I don't know, 180, whatever, just a complete turnaround of back in the 90s. It was like, man, you're taking creatine. That's a freaking steroid. This is terrible. And now all of a sudden, now we're to this point to where it almost, you could argue, is a low risk, high reward overall health supplement. Have you seen any other like supplement or anything like take this kind of trajectory like that before?
To be honest, not really. I think, as you mentioned before, it was something where even not long ago, I remember when I had started it like 10 years ago, almost being afraid to tell my parents or something that they would think it's a steroid or something. But I think now and since then there's been research to build from it, from the cognitive side, the physical health side. So I think it's been much more accepted from that side of things. And I don't think that there's any other supplement that's really done this sort of rebrand where it's been more accepted. The only thing that I can think of in psychiatry, not a supplement, is the resurgence of the psychedelic interest and everything from that front, where before there was a lot of hype around it, but again, it was more of this kind of like, lack of a better word, hippie sort of thing. And then it became not popular. And then more recently, now it's being used as treatment for mental disorders. And again, I think there is still public apprehension around it, but I do think it's also at the same time being more accepted and there's more interest in looking into it. So potentially that's something too that could take that 180. Again, psychedelics have a much different risk benefit ratio than creatine. So by no means am I advocating for people to also do that. But I think it is a similar trajectory where we're seeing interest and then people are like, okay, wait, maybe that's dangerous. And then interest again. But again, I think the risk benefit ratio is very different for that. So yeah, I don't think there's been anything similar to creatine to make that 180.
Yeah, you can't, at least from my understanding, you can't just go on Amazon and get psychedelics. You probably need to. You can't with creatine. With all this, obviously, I feel like I've seen maybe some other potential benefits of creatine outside of brain health and the body composition side of things. And I feel like this probably just stems from just research people are doing. And then like that like leads to, okay, we maybe saw this. So there's some other benefits. One of the ones I did see was like vascular function. Again, I need to go back and see if they use nitrate or what they used with that. But there was somewhere an improved vascular function in like older adults. I know TBI is another one. Is there anything that interests you, or have you seen any other like areas where creatine could also now potentially benefit down the line as we get more research?
Yeah, no, I think in particularly more vulnerable populations, like you mentioned, older individuals that maybe have lower intake, or in TBI, there's actually a good amount of research around there. Again, that's another example of increased metabolic demand where people are experiencing concentration difficulties. They may even have word finding difficulty, not be able to do tasks that they would have before. And again, not to say that taking your 5 grams of creatine is going to undo the brain injury that you may have sustained, but it may make things a lot better. I know I mentioned things like schizophrenia and these other disorders, but I think one of the questions that I get a lot as well too is ADHD. It's such a prevalent condition. So many people are diagnosed with it, whether it's in childhood or whether retroactively someone's going to the doctor and saying, hey, my whole life I've had difficulties concentrating and doing these different tasks. There's actually no trials right now to look at ADHD, but I think that would be an interesting application to look at because again, via the lens of concentration, via the lens of even just exercising, that can improve someone's ability to engage and reduce inattention or hyperactivity, which are these prominent symptoms in ADHD. I think it would be interesting to see potential utility there. I'm actually working on writing more of a similar kind of mechanistic paper for that. I haven't even gotten to start it yet. I haven't had the time, but looking at what mechanisms might be at play and what a good trial might look like for ADHD. Because again, we have stimulants to treat it. Some people self-treat their ADHD with different coffee and all these different things, but it would be interesting to see something like creatine even if it doesn't cure it, maybe that allows lower doses of stimulants. Maybe you don't need medications. I don't know. I don't have an answer for that. So I think it would be interesting to see that literature because it's a very prevalent mental health condition and it can be very debilitating for people. You cannot be able to do your job. You cannot be able to succeed in school because you can't have that level of focus. And anecdotally, just on X, and again, anecdotal evidence never supersedes actual evidence, but I've heard a number of people talking about their ADHD and taking creatine and noticing improvements. So I think it's an interesting signal. And I think I'm fortunate to have that reach to see people say, hey, I've noticed XYZ. And that, again, is an example of how it can fuel ideas. And maybe there is an application there. It's that signal. So again, to summarize, no evidence yet, but I think it's an interesting area where there could be utility.
Yeah, no, that's awesome. And as you were like saying all that, I was thinking about, I think you posted this on X a couple days ago about taking like a phone detox or something like that, how that can help with some of that too. And I'm assuming that kind of correlates or is tied together as well too there.
Yeah. Just giving your time to, it was a study that you put your phone away for 72 hours and essentially, for lack of a better word, your brain would rewired a little bit where these circuits where your attention and everything were impaired because you're so used to just reflexively grabbing your phone, checking your Instagram notification, checking your texts, XYZ. It's just information overload. And then you can imagine why predominantly now short form content has become more interesting because that's what our brains are wired for. No longer do we have these long sort of texts and stuff like that. People just won't read it because our brains are so wired for instant dopamine. I want to read that one line of text. I want to see that one picture. I want to see that one quick TikTok. And that's where that study came from of let's put the phone down for a little bit. Let's decrease that stimulus of what you're used to. Let's just see the real world and read text. And that's even why some of the stuff I like to do is it's a middle ground between long and short form content. I do these threads. It's not just like a one line sort of thing. I start off with that, but I like to get into it. And even for myself, I read the whole paper, which forces me to just sit down and actually read something. Because I even found for myself, I was getting in this cycle of just digesting short form content because I think it's really bad for your focus. And again, perhaps that could be contributing to this ADHD increase that we're seeing from that side of things. I think there's a lot of reasons why on a population level we have issues with attention, which is fueled by a lot of what's around us. And I don't think we always realize that. It's become this kind of culture that we've adapted to, but I don't know that it's necessarily healthy and it can lead to issues. It's just been normalized and that's why it seems healthy.
Yeah, no, absolutely. I see it in myself, right? Where it's if I have my phone, like I always have a bad habit of having my phone around me, like even when I'm working, I can see that I just freaking lose focus and you want to check it, you want to look. And then there's times where like, I'll just be sitting there and I just check my phone. I'm like, holy shit, I can't believe I don't even know why I did that. Like, why did I even check my phone? So it's crazy. I can totally see where, again, if you're not aware of that, I'm aware of it and I still freaking do it all the time, right? So I feel like if you're not aware of it, where you can run into these issues, right? Cool.
Yeah, no, for me, I put my phone on do not disturb. I only check my social media at specific intervals and stuff. Otherwise, it's just endless notifications, endless texts and stuff that you can always be replying to versus you gain control of it if you take a window of time when you're going to respond to all these things. Otherwise, it's an endless cycle. And I think that goes back to the issue of time and research too, where research has changed a lot recently. Now it's Zoom meetings, it's answering emails, it's all that. You don't really have time to think. And that's a big thing for me. I just want to think. I don't want to be bothered by a bunch of different things. For sure, I want to talk to people, interact with people. But at the same time, I think it's unhealthy to have a steady stream of communication where you're just so easily accessible at all times. And it leads you to be so connected to this online world and to value and put your own value on what people are saying XYZ, which again, you've now externalized your sense of self, which is a dangerous place to be in.
Do you take like a specific amount of time, like per week or per day to just, hey, I'm going to think, I'm not going to have electronics around me. And then do you do any sort of like meditation or breath work to like help with that too? And can that be a way to also get what you're talking about there?
Yeah. So I don't necessarily do meditation or breath work, but I try to set those boundaries of not checking my phone all the time. At the gym before too, that was the time where I would always actually take to respond to people on Twitter, blah, blah, because it was like downtime. But now I use it more as kind of like a thinking time. So I won't respond. I won't do that. That's just my time just to think. So that might be my meditation time then where I just am disconnected because again, before I was like, okay, this is 1 hour in between sets. I can just respond to people, do that. But it took away from the exercise itself. It took away from the intensity when you're like getting sucked into a discussion or you see an interesting thread that you want to read. You're no longer present in the moment. And I think I noticed a lot better mental clarity, more ideas coming when I said, okay, at the gym, even though I have the time, this is the best time to reply to people because I'm literally doing nothing in between sets, just not to do that. Like I'm just going to listen to my music. I can use my phone to change the song and that's it. I'm not going to reply to anyone. This is just my time just to exist because I think that's rare for people in today's age to have time for you just to exist because there's so many demands that you have at all time, no matter what job you're in, no matter what your responsibilities are. But I think it's important and it allows you mental clarity, but it also allows you the space to have ideas and just to allow your mind to roam.
Yep, and that goes back to we have these a ton of metabolic demands at all times. So final kind of grand finale with everything here. First, really appreciate your time. Really generous with it. One, can you maybe just give it like, hey, creatine, this is what I think. Are you specifically working on any papers that you can tease or anything like that? And then where can people find you?
Yeah, I guess the big summary for everything is exercise is good for your mental health across disorders, depression particularly, but not to be forced. As well, creatine is a very beneficial supplement. Right now, a lot of literature is 5 grams, but I think there's going to be more and more coming out around the 10 grams. And the big barrier is, or not barrier, the big question is what's going on in your brain from that side of things to see that antidepressant effect. And again, it can be combined with first line treatments like medications, therapy, and potentially even exercise. In terms of next papers, I'm working on setting up a series of papers looking at the mechanisms across mental disorders. So we did depression, that was the one that we had spoke about, but looking at like ADHD, schizophrenia, all these different disorders. And then from there, hopefully setting up some trials. And as I mentioned, it's not me leading, but I've been asked to help input on some trials, pairing creatine with some different exercise modalities. So that was something that I had written in one of my papers a few months ago as a call to action. So it's great to see a response to the call to action already happen. So hopefully in the coming time, we'll see some of these trials come out. But yeah, thank you for having me. If anyone's interested to hear more, mostly I'm active on X. It's NT Fabiano. I try to write a thread every day, sometimes every second day, depending on how busy I am from that front. But I'm also active on other social media platforms like Instagram, same at NT Fabiano, and then YouTube, which I haven't posted there yet, but maybe will eventually. I think it's just been busyness with residency research and some of the social media stuff. So yeah, I'm very hopeful for the field of creatine and exercise and mental health beyond just depression. And I'm excited to see more and more trials to come out. And I think we'll be able to have a more complete discussion as we see some of this literature and the holes be filled. Yeah, thank you for having me.
Yeah, absolutely. It was a great conversation. Really appreciate your time and a ton of great information here. I think people connecting this dot between like fitness and mental health, I think is just super important. So I'm glad you're able to really appreciate you coming on here and chatting and looking forward to all the continuing research around creatine and you obviously getting it out there in terms of, hey, here's where we need to go. Here's what I see. And then now you said you're getting these trials to actually happen, which I think is freaking awesome. Again, really appreciate your time. We'll tag all that in the show notes and everything like that. And we'll talk to you again soon, Nicholas.
Awesome. Thank you.